This segment of Bridge Street is brought to you by Dr. William A. Graber.
Welcome back to Bridge Street. You know, your health is certainly wealth as you get older, and for some, you may need a little help. Here to talk more about that is Dr. William Graber and Judy Flynn. She's a patient of Dr. Graber's. Good morning.
Good morning.
Good morning.
So, Dr. Graber, let's start with you. Let's start with bariatric surgery. What is the history of bariatric surgery? What does it do? Who are candidates?
Yeah, it's a long history, but pretty much what we do now is a gastric bypass, and that's been around for about 100 years, invented by Dr. Emil Roux, but it wasn't for weight loss. It was for ulcer disease, and by the 50s, surgeons had discovered that two things happened. A, well, it cured ulcers, but B, people lost weight, and the other thing is diabetes was getting better. And surgeons decided to try and force people to lose weight and cure their diabetes. So over the decades, that's been developed to what we have now.
Okay.
So Judy, you are a patient of Dr. Graber's. What made you want to undergo this surgery, and how are you feeling now?
Oh, I feel amazing now. I was tired all the time, diabetic. Diabetes was starting to affect my kidneys a little bit. So, you know, I went to a support group meeting and listened to everybody tell how wonderful they felt and how great they did with the surgery and how easy it was, and I decided.
We have some before and after pictures.
Oh boy. Who is that?
You look you truly look fantastic.
Thank you. Oh man.
Dr. Graber, at what point does a patient think I may be a candidate? Is it after unsuccessful attempts at a lifestyle change? Is it a health? I mean, how do you know when, okay, I need to maybe consider this?
Yeah, basically we have some guidelines, something called a BMI, where we take your weight and your height and do a quick mathematical calculation. But generally your doctors are telling you, and you sort of know it, when you're getting big and you're getting diabetes and you're getting hypertension and your joints are starting to ache, chances are, in this day and age, you should start thinking about coming to talk to us, or at least talk to your own doctor about it.
And a lot of insurance companies are actually covering this procedure now.
Right. Most insurance companies do cover it, and our office can help people with that, those issues and the hurdles and how that works.
Okay. Well, you have some information seminars coming up.
Yeah, we have some seminars coming up. Well, we do monthly seminars in our office, and there's informational seminars that are advertised that are in different areas. Not only that, there's support groups. So in North Medical or the St. Joe's building near North Medical, there's one twice a month, and people can show up. You don't have to be announced. You don't have to talk. You can just sit and listen or ask questions.
And Judy, speaking to maybe some of our friends at home who are contemplating having the surgery, but they have some doubts, what would you say to them?
I would say do it. Oh my gosh, it's the easiest surgery I've ever had in my life, and I've had a few surgeries. I was back to work in 2 weeks. I never had pain. I never felt bad. I just, you know, it's just, you start and it takes off and you...
Anything we should consider, doctor, as far as health risk or things like that, any side effects, or is it, I mean, has the procedure developed to a point now where it's pretty standard? I know every procedure...
Oh, no, that's a good question. Basically, it is surgery. No one really wants surgery.
Right.
And we prefer that people lose weight with diet and exercise.
Right.
And if you can't, then people should start talking to us. And there are potential side effects, which we almost can't even list, but we think the risks are definitely minimalized considering the benefits.
Correct.
But everything's a balancing act, as everything else in life is as well.
Yeah.
Well, here is the information on your screen for the information seminar where you can learn more about the bariatric surgery. It's given by Dr. William Graber, and it's Monday, May 14th, starting at 6 o'clock. It'll be held at the Medical Office Center at St. Joseph's Hospital campus, and parking will be validated. That's a good one. And to register for the seminar or for more information about bariatric surgery, you can contact Dr. Graber's offices. Syracuse number is 477-4740, or visit his website, www.drgrabermd.com.
Thanks so much.
Thank you
Judy,
so much.
Thank you.
Thank you.
All right, coming up next on Bridge Street, Walk for Hope, I should say. That's next. Stick around.